Hi, welcome back to my channel. My name is Dr. Nihar Sinan. I'm a plastic surgeon from Manipur. I'm based in Imphal, and in this video, I'll talk about certain things that we need to take care of after getting a blepharoplasty done. So when you get an upper blepharoplasty done, whether it's for a fold or to remove extra skin to look younger, there will be swelling definitely in the post-operative period. This swelling can last for 4 to 6 months. The maximum swelling occurs on the third or fourth day, and then it gradually decreases. Almost half of the swelling is gone by day 7, and by second to third week, around 80% of the swelling is gone. So by this time, you start looking very presentable, but from 3 weeks to about 6 months, there is a very slow decrease in the remaining swelling. So the problem period is usually the first and second week. So if you take really good care of yourself, of your eyes, during this period, you'll have minimal swelling and a very quick recovery. So the first advice that I usually give to my patients is that you need to keep your head elevated. Just like how I'm sitting right now, my position is quite upright. Even if I want to lean backwards, I better do it on a sofa or on the backrest of the bed. It's advisable not to lie down flat, and even if you're using pillows, not to lie down as much as possible. It's also advisable to sleep on a recliner sofa if you have one, or to use a lot of pillows to keep your head elevated, at least for the first night. You should follow this head elevation advice for a week or two at least, but the strictness of keeping your head elevated during night can be relaxed from the second or third day onwards, but it's very important for the first night at least. Second is during the period of development of the swelling, that is the first, second, and third day, you want to keep your eyelids cold. So we do that by using ice packs, and then we apply it on our eyes for 30-second intervals throughout the day as much as possible. So you keep it on your right eye for 30 seconds, then you keep on your left eye for 30 seconds. If you do it for only a few seconds, it's not cold enough. And if you put it for more than 1 to 2 minutes at once, it's too cold and not good. We want to keep your eyes cold so that the blood vessels inside the eyes are constricted, and so you won't have much swelling developing in the initial period after your surgery. Beyond the third day, it's not advisable to continue ice pack application until unless the swelling is of a certain kind and too much, and you need to contact your doctor and discuss about continuing ice applications. Otherwise, normally I advise not to continue it beyond the second or third day. The third very important thing that you need to take care of is you want to stay relaxed, so you want to rest. But rest does not mean lying down flat on the bed. Rest means not doing heavy activities, avoiding strenuous activities like exercise, aerobics, jogging, or any heavy physical work at home. It's okay to move outside, go out in the streets, go to a shop, go for some important work if you are going to be physically relaxed and not strain yourself. Then I advise one to apply an antibiotic ointment on their eyes, maybe once or twice a day for the initial 10 days. The antibiotic purpose of the ointment may not be very useful beyond the fourth or fifth day, but then some of the ointments have these moisturizing effect, which is good for the healing wound. The stitches are removed at least after 5 days, and most of the time I try to remove them by the ninth day. So whether I remove it on the fifth day or the seventh day or the ninth day totally depends on how much uh, wound tension was there. Wound tension means how much, how tight the wound was to close, how easy was it to close, and the kind of suture material used, the size of material used, and whether I put stitches on the outside which are visible on the skin. So depending on these, I decide whether to remove on the fifth, sixth, seventh, eighth, or ninth day. But most are removed within this time period. And then the medications that we prescribe for reducing the swelling, for a good healing, and for pain management, these are all very important. Usually, for pain, I have got reviews from my patients that when the surgery was done very clean, in a clean way, without much bleeding, with a very meticulous technique, most of my patients did not have pain from the second day onwards, so they often did not take painkillers. They only took a painkiller or two on the first day, and after that, they said it was not required, and they were quite comfortable to move around and do their daily activities. Of course, taking care not to strain themselves physically. Next, screen time. Whether using phone, watching TV, watching movie is okay or not. I think it's okay to use your phone in a moderate amount, making calls, replying to some texts, using social media for a few minutes should not do any harm to your eyes in the initial period of your recovery, but excessive use leading to eye strain and using your phone in a dark room on a very high brightness should not be recommended, as it leads to increased blood flow to your eyes, and it kind of strains your eyes and makes the swelling worse. So these were some of the tips for your recovery after blepharoplasty. If there's any questions that you would like to ask, feel free to put them in the comments section and I'll be happy to answer them. Thanks for watching this video, and I'll see you in the next one.